Thank you all for inviting me. I'm here representing Women Hurt. I'm Dr. Anthony Levatino, an obstetrician gynecologist of 37 years experience in the United States. I currently live in New Mexico. And Leslie from Women Hurt is here. She'll be available for questions. Leslie was raped at the age of 13 by an 18-year-old and had an abortion, and you might want to ask her what that was like. Your government has asked you to do a very important function, and I thank you for doing it. But they're asking you to, there's the possibility here of unleashing something on your country, and I want you to understand exactly what we're talking about. In my career, I performed 1,200 abortions, and everything I tell you is firsthand and true. I want to imagine for a minute that you're a pro-choice obstetrician gynecologist like I used to be. Your patient is 17 years old. She's 20 weeks pregnant. Her uterus is all the way up to her umbilicus. If you could see her baby, easily done on an ultrasound, her baby's about 8 inches long, basically the length from the tip of your finger to your wrist, not counting the legs. She's been feeling her baby kick for 2 weeks, but now she's asleep on an operating room table, and you're there to help her with her problem. You walk into that operating room scrubbed and gowned, and there's some instruments on a table to your right. The first thing you want to get is a suction catheter. It's a clear plastic tube about 9 inches long. And picture yourself, if you could, putting that tube up through the cervix into the uterus, and instruct your circulating nurse to turn on the suction. What you'll see is pale yellow fluid running through the tubing into the machine. That was the amniotic fluid that was there to protect the baby. Now, if she were only 12 weeks pregnant or less, a 12-week baby is about the width of your hand. You could pretty much do the entire abortion with that one instrument. Babies this big, they don't fit through catheters that size. So you reach down for something called a Sofer clamp. It's about 13 inches long. It's a heavy instrument. And the business end is 2.5 inches long and 1/2 inch wide with rows of sharp teeth. It's a grasping instrument. When it gets a hold of something, it does not let go. A second trimester abortion is a blind procedure. You can't see what you're doing. And carefully place that instrument, see yourself doing this into the uterus, and grab blindly anything you can, and feel yourself pull, and I mean hard. And out pops a leg that big, which you put down on the table next to you. And reach in with that instrument again blindly. Grasp and pull hard. Out comes an arm just as big that you put down on the table next to you. And reach in with that instrument again and again, and tear out the spine, the intestines, the heart, and lungs. Head on a baby that size is about the size of a plum. And again, you can't see it, but you're pretty sure you got it if you've got the instrument around something and your fingers are spread as far as they'll go. You know you did it right if you crush down on the instrument and white material runs out of the cervix. That was the baby's brains. And then you can pull out skull pieces. And if you have a wonderful day like I had a lot of days, sometimes a little face comes back and stares back at you. Congratulations. You just successfully performed a second trimester D&E abortion. You just affirmed her right to choose. You just made $800 cash in 15 minutes. This is what we're talking about, folks. This is what they are asking you to decide on. I graduated from medical school in 1976, and if you asked me how I felt about the abortion issue, I was 100% pro-choice. This was a decision between a woman, her doctor, and no one, including the baby's father, had anything to say about it. Now, a lot of people identify themselves as pro-life or pro-choice, but when you're a gynecologist and you say you're pro-choice, that means you're going to learn how to actually do abortions, and I did as part of my training, both first and second trimester. It was during my training, when I was doing those abortions and learning how to do them, I met my wife. My wife's 100% Irish. I'm 100% Sicilian, so descent, so we have spirited discussions at times. And we married and wanted to have a family of our own, but found out pretty quickly that we had an infertility problem, no kids. After an extensive infertility workup, she was subjected to one more procedure that was supposed to take 1.5 hours and actually took 4.5 hours. And that gynecologist came out of the operating room and told us that, look, I know I never tell anybody they're not going to have a child, but don't count on it. We were devastated. But we were very fortunate and very blessed, and we were able to adopt a little girl that we named Heather. I mean, since my kids were doomed to an Italian last name, they were certainly going to get Irish first names. And as sometimes happens, after years of trying and years of frustration trying to adopt a child, we were successful. And then my wife became pregnant the very next month, and our son Sean was born just 10 months after Heather had been adopted. Great, I have a millionaire's family. This is fantastic. I have a boy and a girl. I had started having some doubts about abortion when we were trying to adopt. I'm not stupid. I know that's why there's so few children to adopt. But now I have a family of my own, and any doubts I had about doing abortion simply evaporated, and I went back to business as usual. I went into private practice, and I wasn't running an abortion clinic. It was a routine OB-GYN office like most women in this room have been to. Abortion was only a small piece of our practice. But in the early 80s, when I joined another practitioner in New York, we were both practiced abortionists. And we were looking for, people in the abortion industry were looking for a better method of second trimester abortion. We were doing a type of abortion called a saline. That's not done anymore, but it's extremely difficult on patients, difficult on staff, very expensive, very dangerous. And D&E abortions were developed. And we saw an opportunity, and we trained ourselves to do these late-term abortions. We got referrals from other physicians. And as I said, over 4 years, I performed 1,200 abortions. Life was good until June 23rd, 1984. Heather was exactly 2 months away from her 6th birthday. Sean was just a few days away from his 5th birthday. It was a Saturday, beautiful day in Albany, New York, where we lived. I was on call, but it wasn't too busy. We took the children to an amusement park that afternoon, had dinner together. And our kids were playing in the backyard when we had guests come to the house for cake and coffee. At 7:25 that night, we heard the screech of brakes out in front of our house. Our daughter Heather had been hit by a car. She was a mess. I'm a doctor. I'm supposed to be able to save people's lives. My wife was an intensive care nurse. This was our job. But it made no difference, and she died in our arms in the back of an ambulance that night. Now, if you have children, you may have some idea of what that might feel like. If you haven't been through this yourself, you have no clue. I hope you never find out. And I don't know how long it was after Heather's death that I did my first abortion, but I ripped out an arm or a leg, and I just stared at it in the clamp, and I got sick. I finished the abortion. You know, you can't stop an abortion. And I didn't talk about stacking body parts to say something shocking or gross. When you do an abortion, you have to keep inventory. You have to make sure you get 2 arms, 2 legs, and all the pieces, because if you don't, your patient's going to come back infected, bleeding, or worse. So I finished it. And for the first time in my career, I really looked at that pile of goo on the side of the table. And all of a sudden, I didn't see her wonderful right to choose, and I didn't see what a great doctor I was helping with her problem, and I didn't even see the $800 cash it just made in 15 minutes. All I could see was somebody's son or daughter. You often hear about how abortion is absolutely necessary to help preserve the life of your mothers. I worked for over 10 years in a tertiary referral center, high-risk OB, in Albany, New York, and I saw hundreds of patients with serious problems in pregnancy, out-of-control diabetes, heart disease, cancers, where the pregnancy was a true threat to their lives. What they don't tell you when they talk about how abortion is necessary to save a woman's life is that it takes 2 to 3 days to prepare them for that procedure. I have terminated hundreds of pregnancies in my career to save women's lives, and I didn't have to kill a single baby in the process. If you let this genie out of the lamp, you will not be able to put it back. First, it will be because only the hard cases. Then it's going to be for the health of the mother, and we can talk about how that's defined in US law if you ask. And soon enough, it really will be choice. Thank you.